As health officials work to get more people vaccinated against COVID-19, they're also reminding people that securing your dose doesn't mean you can begin to ignore guidelines.
News 8's Lindsay McComal spoke with an infectious disease specialist for some insight.
Right now, we're not entirely certain if people who are vaccinated can actually carry and spread the virus to other people. That is a question that remains unanswered at this time, and there are going to be some observational studies starting up here very soon that will hopefully answer that question in the coming months.
And when we talk about the science and the data that is still needed to determine, if someone who does become vaccinated can still pass along the virus, how long typically could that take when you're talking about collecting that and really kind of figuring out the impacts?
That's a good question. It probably will take several months. I would hope to think by sometime in the summer or the fall, we should start having some answers, because I think the people who are going to do this research want to make sure that they have a population of people that is vaccinated, that they can follow and what they're going to have to do is do swabbing on them periodically to see if they're carrying virus, et cetera. So I would think by the summer or fall, we should have at least some preliminary answers to this question and a better idea, okay, how well is vaccine protecting people from at least carrying the virus.
And how much does the unknown really play a role as we continue to navigate the pandemic? And how is that some perspective people need to keep in mind too? I think it can often lead to additional frustration or questions if it's like, we don't have the answer right now, but we will in the future.
Yeah, I can appreciate that the unknown is very frustrating. In the medical community, it's every bit as frustrating for us too. I mean, we all want answers to everything. We want to know that the vaccine halts the virus in its tracks. We want to know exactly how we can manage people with long-term COVID. We want a treatment for people with COVID in the hospital right now. And I appreciate from the general public standpoint, they see all this information coming out and it's changing all the time. And while we have learned much, we have much to learn yet. And we're learning a lot, and I think we're making a lot of progress, but, people still need to be patient and just realize this is a very new thing. We're still trying to figure out exactly how this whole virus interacts with the human body and to get more definitive answers so that we can make better and more solid recommendations going forward.
That was Lindsay McComal reporting.